Before we get there, debates around the HIV prevention pill PrEP have highlighted the gap and misinformation around the drug. It's well known, of course, and PrEP does remain an effective HIV management and prevention tool, particularly for young people. Now, as we near the end of Youth Month, let's take a look at some of the issues that young people living with HIV are still facing even before the COVID-19 pandemic. Join us for the conversation is Sindi Shangase, Executive Director of Positive Women's Network. Sindi, morning to you. And I was going to ask the question, I'm sure you knew how difficult it's been living with HIV/AIDS and living with HIV, being a youngster in South Africa during COVID-19. But let's be honest, this was an issue long before COVID-19 came around, wasn't it?
Yes. It's been a long-standing issue. In fact, young people, particularly young women in South Africa, are 3 times at risk than their male counterparts in terms of HIV, risk, which means that young women are really at risk of contracting the HIV virus. And it is very important to provide support to young women living with HIV, but also equally important to ensure that young women who are not living with HIV can prevent HIV transmission.
Let's talk about why it's so important for young women to be able to have something like PrEP as well when it's a young woman living in South Africa, Sindi. As far as HIV is concerned, there's a stigma that's attached to young women in South Africa having HIV, that they're not in control of their sex lives. Often their families banish them as well. They should be getting a lot more support, but they actually end up facing second victimization, don't they?
Absolutely. With young people, we are making progress in one area, but then particularly in science, I really think science is on the side of young women currently, not just in South Africa, but globally. With PrEP being available as a pill that a young person can take, she can go to the clinic and request the pill and take the pill to prevent herself from getting HIV. That on its own is a great achievement for young people because it puts control in their hands to ensure that they are protected. But what we are finding is that, as you mentioned, the issue of stigma, we are finding that communities and families are not supporting the young women who choose to protect themselves. Instead, they end up reprimanding them. And as communities in South Africa and as families as well, we need to acknowledge that when we reprimand young people for actually taking the initiative to protect themselves from an HIV infection, we are actually practicing it becomes a harmful gender practice that is oppressing young women, that is reducing their ability to define their futures. And as you're saying, it's providing, it's also victimizing young people. So it's very important. My plea today is that even with the presence of science, the most important thing is to ensure that young people, in addition to healthcare services, have care and support within the communities where they live and also within the families. So what happens when they don't get support? What happens is that they default, they stop taking the drugs that is supposed to support them because they have to hide them from their families and they have to hide them from communities. In addition, they also have to hide this medication from their partner. And sometimes we've seen cases where young women, when their partners discover that they are taking this drug, because it's an antiretroviral, antiretrovirals are also used to manage HIV. And because of the lack of information about how ARVs are used, people still believe that ARVs are only used to manage HIV. They don't understand that you can use ARVs to prevent HIV. So then the young women end up facing gender-based violence in the hands of their intimate partners. What we have learned recently as well in South Africa, which we are very happy about, is the depivarin ring. We now know that there's a depivarin ring which a young woman can get and have inserted in her body without the family knowing, without the partner knowing, and it can stay in her body for up to a month. And it provides protection for up to a month, whereas with the pill, she still has to take it on a daily basis, which increases the risk of people knowing that she's taking the pill. We feel the pill ring should be rolled out countrywide to ensure that young people's risk to gender-based violence is reduced, to ensure that young women's adherence to HIV prevention, is enhanced. So we are really calling for young people to come out in their numbers and work with us and the government, particularly the Department of Health, to ensure that the ring becomes accessible to young people. And the other parts that
Sindi, I appreciate it, because I think you've given so much fantastic advice. This new ring as well. Sindi, I'm going to say thank you for the moment speaking to us this morning, not just about PrEP as a drug itself, but there's a new way for young women to protect themselves and not only support themselves during HIV/AIDS, if they do have that, but also prevent HIV in the first place. This call-out for these rings to be run out and rolled out around the country. My thanks to Sindi speaking to us this morning from the Positive Women's Network. It's Sindi Shangase, the Executive Director, speaking to us on ENCA. Newspaper.